Kia ora koutou. Thank you for joining our live stream. You may know me or you may not, but my name is Adri Isbister and I'm the Deputy Director General for Disability at the Ministry of Health. Welcome. Next to me is Katie Sheriff, who is one of our team monitoring your comments and questions. And we also have the lovely Rosetta, who is interpreting our conversation today. I'm going to get Katie to outline what you can do if you have questions during this session.
Cool, kia ora. I'm quite nervous, so I'm sorry if I'm speaking quickly. So we are going to be spending a lot of time answering your questions. So if you want to ask us a question or leave a comment, so you can comment next to the video on our website, you can comment on YouTube, or if you don't have a Google account to do either of those, you can email us at disability@health.govt.nz. We may not be able to answer all of your questions during the hour, but we will answer as many as we possibly can.
And I'm aware that not everyone can join this live stream tonight. And it's also as a result of 20 community conversations that we've had throughout New Zealand in the last few weeks. But if you know someone who hasn't been able to join us tonight, please let them know that this video will be available to watch on our website when we finish. And we'll also have a transcript of this conversation up on our website in 3 to 5 days. Plus, we have an easy read version of the feedback that we've received in our community conversations, and that will be available in the next 2 to 3 weeks. And if you know someone that does not have a computer or a smartphone, they can write to us and we will send them a transcript, or better still, you send us their contact details at disability@health.government.nz.
Disability@health.govt.nz.
Oh, that's
Nailed
right.
it.
Sorry,
Yes,
sorry.
Don't be sorry.
And we'll get in touch with them. Some people have asked us questions about very specific cases, which we absolutely cannot answer in a public forum. We will, however, get back to you personally. So I appreciate that many of you have taken time out of your busy and possibly stressful evenings to be part of this conversation. So I really do thank you for this. But before we get started, I want to share a bit about who I am and what I do as Deputy Director General Disability. I am no stranger to the health and disability sector. I was the CEO of Life Unlimited, a disability support provider for 14 years. Then I moved on to being Chief Executive of Green Cross Medical, and most recently in the last few years, I was the CEO of whānau DHB. I'm also Oma, which is grandma in Dutch, to James, my 4-year-old grandson. James has hypotonic quadriplegic cerebral palsy. It's quite a mouthful, isn't it? He is blind and non-verbal. James also has no swallowing reflex and he needs to be aspirated. But this does not mean that James can't vomit, because I tell you he can. And he also seldom sleeps more than 2 hours a night. So I know through my own lived experience as a whānau member what life is like for my family living with a disability. But I'm very aware that this is a very individual experience, and I wouldn't want to assume what life is like for you and your whānau. I have been in my role as Deputy Director General Disability for 6 months, and it is my job to lead the Disability Directorate. My role is to plan and to use our limited resources to get the best outcomes for you and your community for disability support services. It is also my responsibility to ensure that we are leading a fair and equitable system where everyone gets the supports and services that they need if they're eligible for disability support services, no matter who they are or where they live. For those of you who aren't familiar with the Ministry of Health's Disability Directorate, we have a team that manages over 1,200 contracts with over 900 providers, so that approximately 37,000 people in New Zealand can receive disability support services. We have a team that develops policy and advises ministers on issues impacting disabled people in whānau. We have a team that focuses on auditing, monitoring, and data and analysis. And we also have a system transformation team working to transform the disability support system. We are a small and busy disability directorate. I am thankful, and I've said this in a number of the community conversations, to Dr. Ashley Bloomfield, who's our Director General of Health. He made the decision to reinstate the Disability Directorate in October 2018. And I think that this gives disability the level of importance that it needs within the wider health and disability system. But we are, as a directorate, very mindful that there are challenges ahead. And these are not just ministry challenges. I think they're collectively ours as a whole community. Now, more than ever, we need to work together to build a sustainable system and ensure disabled people and their whānau continue to receive the support they need to lead their best life. And you know what works for you and your whānau, so we're looking to you to help us develop solutions as we face the challenges ahead. It is so important to me in my role to hear firsthand from you how disability supports and services impact you every single day. And it's been amazing in the last few weeks and probably in the last few months since I've been on board to listen to your stories, some humbling, some really positive, but at the end of the day, we do know we have challenges ahead. And so we've been asking for feedback for some time, and we absolutely know that it can be onerous. And I appreciate that it can sometimes feel like you share your stories with us time and time again. And you certainly have through the years. But it is important to me, newly at the directorate, and important to the directorate for us to hear these stories. So I thank you in advance, because the advice that we give to ministers must reflect your voices and what matters most to you. Over the years, as I said, we've asked for feedback on a number of Ministry of Health and cross-government, so cross-agency strategies. When I talk about cross-agencies, I talk about MSD, ACC, housing, education. But we have heard that disabled people need to be heard and supported when they speak up. You've told us nothing about us without us, which means that we can't make decisions on our own as a directorate. Disabled people, whānau and carers should have easy access to healthcare, just like every New Zealander. So you should be able to access your GP. You should be able to access hospital and specialist services just like anybody else. People and providers want more flexibility and choice for services, supports, budgets, and contracts. Supports and services should meet the needs of groups that can't always access the same level or type of services as other people, such as Māori and Pacifica. Government agencies need to work together more effectively. And you've also told us that you want us to be more transparent and open about what we're doing and how this impacts on you. So here we are today. Throughout our community conversations, we ask people what a good day looks like for them. Also, what a bad day looks like, and what changes we, as a Ministry of Health Disability Directorate, can make or influence. So I really want to sincerely thank every single person who shared their stories. We heard some, as I said before, some deeply personal and emotional stories that has truly impacted on us. But the best thing about that, it's truly impacted on our strategy going forward. Are you moving my screen? I'm just asking Katie. I think she's moving my screen.
No, sorry, I'll jump in really quickly. So thanks to so much to everyone who's watching. And if you've just joined the stream, you can ask us questions in the comment box next to the video, or you can email us questions at disability@health.govt.nz. Sorry for confusing you. Sorry,
That's okay.
everybody. Bear with.
Oh, dearie me. This
we're
is
here.
absolutely fine.
There we go.
So I hope that today that you can see your feedback reflected in the themes that I'm going to share with you next. So we've heard from many of you that you want more flexibility, and we talked about that before. And this is a really big focus for our directorate over the next 5 years. This includes greater choice and control for disabled people, changing the way that we contract with providers to support innovation, and flexibility to respond better to disabled people and their whānau. People told us that a commitment to supporting families such as siblings, parents, and partners could be reflected in our Disability Directorate's vision. And we met with many people who struggle day to day and simply don't have the time or supports to look after themselves. Carers and family members spoke about how important it is that they look after themselves so that they can look after others. But the reality is that for a lot of people, it is very complex. And we'll keep working with you to find ways that support families to get the respite that they need. People want to see ongoing commitment to improving services and outcomes for population groups such as Māori, Pacifica, Asian peoples, and people from refugee backgrounds. We heard you. We agree, and working with these communities to ensure that there's an equity across the system is a focus for us. There was strong feedback to make our communications better by having information accessible to everyone and hearing from us more often. We heard how important it is that we're transparent and open, and that you are too. You told us that if we truly going to work together to build a sustainable system, that we need to have ongoing dialogue with you. This also includes engaging with people who don't have a voice, like my grandson James. How do we ensure that we're representing everyone in the disability community? This is something that we're exploring right now, and we need to hear from you about ways in which we can reach and engage with people that we aren't hearing from. People told us that even knowing which agency delivers what support is a minefield. So there's an opportunity for us to work with other agencies to paint a clear and easy to understand picture of what disability supports and services are available to whom. People said that we needed to have a single source of truth, and that led to discussions about community navigators, connectors, and how we can support people in the community to help others navigate the system. We also heard that we could support, strengthen, and promote the workforce, people who care for and disabled people. People told us that we could do more to ensure that carers are safe when they're working, and that they're getting the training and development and capability support that they need. They want to enhance their careers, and they want to deliver meaningful services to people. This also includes supporting people who care for family members, and we were challenged to find ways to make sure that people have the development and training that they need to keep themselves and their families healthy and safe. We won't be able to address everything that we've heard quickly, and I can't promise that we can fix everything within the next 5 years. The changes that need to happen will take time in order for us to do them properly. But I can assure you that what we heard has made an impact on us. We're currently reworking our strategy, where we're going, to make sure that what we heard and the outcomes that you are seeking is included. And we will share this with you by the end of this year. But I can share with you an overview of what we are focusing on, such as investing in early intervention, so people get support they need much earlier. Now that can mean in children's services, or it can mean at an onset of a condition that might be going to be disabling. You've said that you would like us to, and we want to focus on building a more person-directed services for support, so disabled people and whānau have more choice and control. Our focus needs to be working across government and communities much better than currently. Our focus needs to be on equity, on upholding the Treaty of Waitangi and ensuring that supports and services work for Māori. We need to have our focus of working with and supporting communities so that everyone is included. So raising the visibility of disabled. We need to focus on using our resources better, those resources within the communities, within the ministry, and within providers. We need to focus on using good data and analytics so that we can make good decisions. And we do need to focus on working with providers and reviewing contracts for disability support services in order to become more flexible. And that leads to the next thing, which is about enabling flexible supports and services. And of course, being transparent and open with you. And as you know, and as was announced on the 7th of July by the Prime Minister this year, we're also making changes to funded family care to recognise the value of family carers. At the moment, we're diving into the details of these policies so that we can make changes fairly. And these changes are coming in 2020, and we're keeping people updated about what we're doing and what these changes mean. Just have a look at our website. We also have pockets of innovation happening throughout New Zealand, and these pockets of enabling good lives in Christchurch and the Waikato, and the prototype transform system in mid-central called Mana Whaikaha. So there's some really good stuff happening out there, and we're aware of that. But for those of you who aren't familiar with these pockets of innovation, they represent partnerships between the disability sector, government agencies to transform our current system. Underpinning this work is the Enabling Good Lives vision that in the future, disabled people and their families will have greater choice and control over their lives and supports and make more use of natural and universally available supports. While these are helping disabled people and their whānau live better and more independent lives, we are really aware, and we heard many times in the community conversations, that this approach is not available to everyone in New Zealand. So it hasn't been developed and provided in all regions. So our challenge is to provide advice to ministers on options about how we can change or transform the current system so everyone has more choice and flexibility over their disability supports and services. We're still monitoring the outcomes from these approaches, and we'll keep you updated as they evolve. We do want to now, though, throw the conversation over to you, and thank you for listening to me. And we're going to have some questions and answers. There's a whole team of people sitting behind the scenes with me, and they've been monitoring your comments and questions. And we've also received a number of questions in advance. So what we're going to do is I'm going to ask Katie to ask me the questions, and I'm going to be able to answer those. So thanks, Katie. If you want to start that'd be great.
Absolutely. So yes, you can still ask us questions and comments and stuff. Let's all be kind to each other though. So Adri, I should get a microphone. A number of people have asked us why there's a difference between what people can get from ACC and the Ministry of Health.
Okay, that was a question that was asked in many of the community conversations, that they are two different systems. ACC is an insurance-based system, no fault accident compensation system. Our disability support system is under the Ministry of Health umbrella, and it's about disability support and what you might need for that. So that is not a accident, it's disability support. And as I said, we've had a lot of people ask those questions, and that's the answer.
Yeah. So you spoke about system transformation before. a lot of people, and we also got this quite a lot in
Yeah.
our community conversations, and thank you for coming to those. A lot of people have asked us about system transformation and when or if this is going to be rolled out around the country.
Well, I mean, I got a question in the community conversations about, I hear you're going to roll this out in 10 years. Now, what we're looking at right now in terms of our strategy and what you've been feeding back to is how do we scale up systems transformation, not in 10 years, but how do we do that in a far better time frame than what we've cut, than what people have been perceived as happening. And I know that we have to wait for some of the evaluation, but we see that there may be next year some opportunities working with our providers and our contracts to create better flexibility in different regions. So we're going to look at how we scale up systems transformation in a far more sort of organised manner in other areas.
Cool. People have also asked us what's happening with iChoose, but for those people who aren't familiar with iChoose, do you want to explain a little bit about what it is?
Yeah, well, so iChoose and the development of iChoose happened about 3 years ago. So it was a bit before my time, but I understand that iChoose was developed to provide a better way of carer support for people needing someone to come in and care for their child whilst they had a bit of a break. People found it really hard to use the funding that they got through carer support. It was a daily rate that, and obviously that's still happening now because we did pause iChoose, and iChoose was a more flexible way of funding carer support. It meant that people got a single allocation of funding, and we are looking at how we can implement iChoose in a fair and equitable way. Because when we started looking at how we can roll this out, we ended up having people that may have lost their allocation or had it decreased somewhat. So we need to do this in a far more equitable way than what was happening. Watch the space, because we're hoping to get something off the ground next year.
And we'll keep people updated on our website and other channels as well. And that's something that we're quite keen as well. If there are ways that you want us to be talking with you, please let us know so that you can be updated with what is happening as well. So Stephanie has asked us, why is the new system refusing to approve residential care when that is what someone is asking for?
Okay, well, the new system, I'm assuming that Stephanie means systems transformation or the mana whai kaha prototype.
I'm not quite sure.
Okay, well, the new system is not refusing to approve residential care. What mana whai kaha are doing is giving people choices, which includes a range of options in community living. So there is no strategy to refuse those wanting residential care.
So Ursula has asked us about respite, which is something that we heard quite a lot as we went out around Aotearoa. And she wants to know what action has been taken to ensure the physical and mental well-being of full-time parent caregivers, specifically single parents, in light of the severe shortage of appropriate respite facilities throughout the country.
Okay, well, we did hear that within our community conversations, and there is no easy answer because some of that is about capital expenditure, some of that's about service development, provider development. The Ministry of Social Development is also leading the Carers Action Plan, and that's been under consultation July to August and is due to be launched in late 2019. And respite for carers was a common theme in the feedback that they received as well. And what we will do is we'll share more information with people about these areas when we do more work on it. As I said, there's no easy answer, and I'm not going to not tell the truth.
Yeah.
So we want to work with you, but we do need to work with providers, and we need to work with the community about what actually is needed. And totally acknowledge that people need and require respite care.
Oh, thank you. We just want to we're not stopping, don't worry. I just want to say thank you so much to everyone that's sending in questions and comments. Please keep them coming, because we're here until about 7 o'clock, and it's only 6:25 now.
Yeah.
So you've got us. So Hannah has asked us about a question about support for couples with one person having a disability. So Hannah has asked, what is being done to bring equality to couples who may get different levels of funding and support?
Okay, really good question, Hannah, because the assessment process for assessing someone's disability is about the individual with a disability. So a needs assessment service coordination agency will come and provide an assessment for an individual, and they do take in the holistic view as well. So one person having a disability means that one person has the assessment. We have heard, however, that a number of people have found that that's a real strain on relationships. And much like you, Hannah, we are being challenged to think about what supports we can provide to couples, and how we can ensure couples receive equitable support is certainly not something that we have an answer to right now. But you would have probably been following the funded family care and the fact that that is going to be put in place, because it may be that if your partner has high or very high needs, that you're able to have funding for caring for your partner. And so have a look on our website and see if that's something that might benefit you.
Okay, sorry, one has just come in now.
Mm-hmm.
Will the number of specialists such as neurologists be increased in the near future?
Okay, well, there's another answer I do not have, even though I do come from DHB land just recently.
You do.
So I'm aware, and we are, as a Disability Directorate, doing a lot of work with Health Workforce New Zealand, because they're under the Ministry of Health umbrella. And there is a workforce strategy, and in terms of specialists like neurologists, I truly don't know off the top of my head whether or not those numbers are going to be increased in the near future. However, what we can do is we can find out for you and make sure that we post the answer on our website.
Yeah. Our team in the background as well have also given me a little assistance. So we are part of Disability Services. Sorry, they were just popping up with comments at the moment. I beg your pardon, everybody. So we're about supporting disability, supporting disability and disabled people with community-based services and respite care. So special services such as neurology, they are provided through the wider health system.
Yeah.
So that's your local DHB. But yeah, as Adri said, we can keep you updated.
Yeah.
Sharon has asked us how we envisage supporting the availability and development for communication supports, for instance, augmentative and alternative communication.
Okay, well, again, it's you are able to access that service through a NASC assessment. And I'm not 100% sure about the availability of that service. I'm aware that there is a waiting list. If you do have a problem, you can actually ask us about that. In terms of skill development for communication supports, I'm not 100% sure of where we're at with that, but we really try and ensure that we have that available. And for those that are needing it desperately, I believe, and I'll have to talk to my subject matter expert, that we have
I've got them over here.
Okay,
yes.
All right.
So, we have provided more funding this year to support communication and assistive technology. So that's great.
That is fantastic.
Which is reducing wait lists, which is fantastic for people who need that. Sharon has also asked us if the workforce action plan is going to be updated.
As I mentioned before, we've got health workforce within the directorate, within the Ministry of Health, and I'm working really closely with DDG, or the Deputy Director General of Health Workforce, and so we're looking at how we integrate supporting the workforce, particularly the workforce that works in the disability sector, within our workforce plan. And we're not only thinking about ways to work with them, but how do we ensure the capability that the community and disabled people expect and want within the workforce. So that, again, I think is quite a long-term strategy, but we have kicked off that piece of work.
So Kim has asked us to clarify the difference and criteria between disability support services versus health services for people with a disability.
Okay. Our criteria for accessing disability support services is government policy. And the eligibility criteria is, and I'm speaking in an overall fashion, is if you have had an impairment for a period of 6 months or longer that is sensory, intellectual, physical, or behavioural, you can access an assessment for disability support services. If you have a health need, you can access a health service just like any other New Zealander. So we've got general practitioners, you've got hospital health services, you've got specialist services, and you are able to access those services. There is payment for or a co-payment to your general practitioner, but hospital health services, public hospital health services are free. So there should be no barrier to you accessing health services.
We've got questions flying in, so thank you so much. A number of people have asked how the Ministry of Health sees rare disorders fitting into disability support services.
Okay. I won't go over the eligibility criteria again, but if somebody with a rare disorder meets the eligibility criteria, they can access an assessment for disability support services. So it doesn't matter, because a rare disorder is a rare disorder, and they may have an intellectual or a physical or a sensory behavioural need, then they can access disability support services. However, if there's a medical need, we do have hospital health services that people can access.
Oh, thank you. So we've got a couple of questions that have come in through the feed just now about enabling good lives. I'm going to read them verbatim if that's all right.
Sure.
So will enabling good lives with an individualised funding create a system similar to free market capitalism where disability service providers begin competing over disabled people's funding? Additionally, will we see a massive influx of unvetted small new providers with EGL individualised funding? Entrepreneurs may find ways of profiting from people's funding.
That is a really good question, and thank you. At the Ministry of Health, Disability Support Services, we are accountable to public funds. So there will always be a way in which to monitor what goes into the system. So no, it will not be a free market. As you know, we have individualised funding, and that's available throughout New Zealand. And we have host agencies, or there is a monitoring function in that. I understand, and I think that they're calling some of these providers in the mid-central region, they're calling them pop-up providers. They are people that are still accountable to our taxpayer dollar. So there may be a perception that is slightly different, but the truth is we are responsible for public funds, and we have to be fiscally accountable. So thank you. That was a good question.
And I guess enabling good lives as well. I mean, it's about giving disabled people and their families more choice about their support services, and individualised funding is a mechanism for the disabled people to employ or engage their own support workers. And so enabling good lives is about bringing that vision and principles of EGR to life.
Yeah.
We have had a question about providers, speaking of providers, and whether we monitor and hold them to account for the services they provide. So that kind of rolls off quite nicely, doesn't it?
Yeah, it does. It does. And now we have a monitoring and quality arm within the Disability Directorate. And that division takes complaints and we look into what's happening in provider land, but we do have a monitoring and audit program. If there's anything that we feel is at real risk, we can do what we call a surprise audit, but we do hold providers to account. In saying that, we have to acknowledge that so many providers do the very, very good work that's expected on the coalface, right? And we have to have a relationship with them. We've got 900 providers and 1,500 contracts, and it's our opportunity into the future to think about how we do contract, how we do monitor for outcomes. So again, a really good question, and thank you.
People have asked how current barriers can be removed to enable a connected system.
Okay, well, some of the things that I was talking about before in terms of working across government, that would really, really help. And that's happening in mana whaikaha in terms of we've got a relationship and a partnership with Ministry of Education and Ministry of Social Development. And so we're sharing funding to enable person-directed care choices in community living. And the other thing that can support that is like navigators or connectors in the community. But the long-term thing is how well can we work with other agencies? And it's certainly part of our strategy.
Yeah. It's also, we talked to a number of providers about this as well, and how can our contracts support providers working together. So it's, you can go to essentially that one-stop shop. Somebody's just asked us why we are not working with the Ministry of Education to foster lifelong learning.
Okay, well, we do work with the Ministry of Education, and I'm not quite sure what you mean by lifelong learning.
So they've also said that severely disabled kids get good support at school, including like physical therapy, but at 21 they leave school and the support plummets.
Okay, so we know, and I'm really aware that transitioning from school can be difficult, and it's certainly an area that we can do more work. The Enabling Good Lives in Christchurch is a very good example of where school leavers are able to access more meaningful and enduring support. So that's been going for a few years, and as I said before, how do we scale that into other regions is the question we need to ask ourselves and think about how we do that.
Mm-hmm. We've also been asked about what thinking we've done, the Ministry of Health, about the complexity of families with multiple disabled family members and multiple generations of people in support roles.
Yeah, and these aren't new issues, and we've heard that in other community conversations, and we totally acknowledge and recognise the need to support people in their own family context. And this often means the supports will be provided to more than one member of a family in a way that works for that family. I'm thinking that if there are ways in which you think we can do things better, we're open to your comments.
Adri, a number of people have asked us why fetal alcohol syndrome disorder is not included in disability support services criteria.
It's the same answer as rare disorders. Our criteria is government policy, and the criteria is, again, as I said, if you have an impairment that's physical, intellectual, sensory or behavioural that lasts a period of 6 months or longer, you are able to have an assessment through a NASC organisation to see if you're eligible for disability supports. So people with fetal alcohol syndrome are in fact included and able to receive disability support if they meet that criteria.
Sorry, we've got questions just flying in. Someone wants to know why the ministry is not changing the funded family care assessment criteria.
I'm going to have to find that answer. I don't know if our subject matter expert has.
I think actually I've asked a question that actually I can answer.
Okay, you go.
Yay. So yes, we are making changes to funded family care. And these are in line with, for instance, we are repealing Part 4A of the Health and Disability Act, which many people have described as discriminatory. We are also changing a criteria so spouses, partners, and parents of people with high and very high complex needs can get funded family care. We're also raising pay rates so that they're in line with pay equity. So, for instance, people who are getting funded family care now are people who will be eligible for it in the future will go from minimum wage of about $17.50 to between $20.50 and $25.50. You are right. We are not changing the assessment criteria, and there are no current plans to be changing the assessment criteria. We are essentially just changing in the ones that I spoke about
I'm
before.
assuming that the criteria is the high and very high.
Yeah.
Okay.
So there will be more eligible people for it once we include partners, spouses, and parents. Alrighty. So somebody has asked, what does the repeal of Section 141 mean for families who would like their child to attend a residential school? So this is about
the repeal of 141, and I can speak at a higher level on that rather than the detail. Because I'm not sure if I've heard that NASC is really discouraging about this option. So Section 141 and the repeal means that disabled children can access the care and protection that's offered by Oranga Tamariki just as any other non-disabled child. So, however, as DSS, we still offer the disability support. So we're working very closely with Oranga Tamariki to ensure that everything is in place. I don't know if I can say anything else because I haven't actually heard about NAS being discouraging. If you have something that you want to share with us, you're most welcome to.
Somebody has asked another question about funded family care, which I can ask and then answer for myself if you'd like. So they've said, I have 3 high needs clients that have asked to care for their own families under funded family care, and they were told to wait until next year. Is this right? I mean, it's quite hard to comment on your personal situation without knowing that. I mean, the NASC at the end of the day, they are the ones that do the assessment. If it's because of the eligibility, the criteria to include spouses and partners, those changes are happening in 2020. They're not happening this year.
Yeah.
So that might be it. But I mean, without knowing the details, it might also be we are changing it. So with funded family care, the age limit at the moment for funded family care is 18. We are changing that. So you don't have to be 18. So that might be another reason, but
there is another reason, and that is that the legislative process takes time. So it's got to go through ministers and cabinet, and the policy and the writing of the policy is a government process that we must follow, and that does take time.
Okay, another one. Can funding be provided for a longer period? It is really difficult to plan and hold staff when there is an annual review and no one ever knows whether funding will roll over.
Okay, great question, and something that we're working on, and watch the space, I say.
So I beg your pardon, I don't know what this acronym means, but people with HCN experience big gaps in disability support services, such as no PC support during the day hours. So this means a huge strain on the disabled person and often on a single family carer. What is being done about this?
Yeah, so HCN is high and complex needs.
Okay, thank you.
And absolutely is a strain on the disabled person and a single family carer. And it's really difficult for us to be talking about individual situations. So I absolutely need to encourage you to talk to your NASC about this.
Someone has not asked us a question, but they have raised a really good idea. I would love to see a voucher system for accessing therapists, such as SLT, OT, and physio, that would give people choice about therapists. Then if you choose a more expensive therapist, you can top up.
Well, brilliant. Thank you. I do think that's a good idea.
Thanks. Somebody has asked, how will the monitoring and audit program be applied to individualized funding and the plethora, great word, of emerging micro providers?
I can't tell you that right now, but I can tell you that's part of our strategy, is to ensure that we have a really good, robust monitoring and audit program. We do have one now, but we know that we need to do better with that.
Somebody has also asked us, is there a way of standardizing needs assessments? There seems to be huge variations in assessments.
The very nature of assessments mean that they're individualized. My grandson, James, is not like every other child with hypertonic, quadriplegic, cerebral palsy, and blind. So it is individual, right? However, we do want to ensure that disability supports allocations are fair and equitable. And I'm wondering if that's what you're meaning. And we're aware that there is a bit of work to be done on ensuring that that happens in New Zealand.
Somebody asked, is enhanced individualised funding going to be made available across the Auckland region? So Adri, should we start with what enhanced individualised funding is?
Well, enhanced individualised funding is where you get a allocation of funding to buy your own home support and personal cares.
Mm-hmm.
Pretty much. So I'm going to be very basic with the answer. Enhanced individualised funding is where you can be more flexible with your funding allocation. Mm-hmm. And if you need something other than home-based support services or personal cares, you can purchase that as long as it is to do with your disability support needs. And we're aware, and we've definitely been made aware of this in the Auckland region, that they don't have that, and they've heard about it being in other regions, and such a good outcome. So is it going to be made available across the Auckland region? I'd like to see it being made available across a lot of regions that don't have it. And but we need to be working with our providers to ensure that the contracting we do with them is such that they can support that.
Mm. And I guess that's something as well. I think that's a challenge for our directorate, is about how we can pick up these pockets of innovation and, make sure that everybody can get them.
Yeah. Fair enough.
Somebody has said, it sounds like individualised funding is the only option available. I dislike it. So how are people like me going to be catered for when caring for highly needy and multiply disabled sons?
Yeah. And IF is not the only support. And we know it is not for everyone. We have new types of support, such as choice and community living and flexible disability supports. And while they're not available everywhere, we're looking at how we can expand these options. Now, as I said to you in the very beginning, we're looking at how we scale these things up, because totally acknowledge that.
Okay, cool. Somebody says rare diseases are no fault of the sufferer. So will the Ministry of Health be taking action to make sure that disabled people with no fault disabilities receive the same level of funding as those on ACC? So that's what we talked about before, isn't it? That the difference between ACC and the Ministry of Health, and opportunities for us to work with them and learn from ACC.
Yeah.
Those are all the questions I've got, but actually some people have emailed some through. ACC. Yeah. What is going to happen to the DIAS service? So
DIAS is Disability Information Advisory Service contracts. Mm-hmm. And there are a number, quite a few providers in New Zealand that hold a DIAS contract. And at this point, we would really like to hear from DIAS providers about what are the barriers that they're seeing and how they might work together and who they do work with. And so there's a few questions there, no answers. But at this point, and particularly thinking about community conversations and the single source of truth and the advancement of technology, how do we, well, I'm not a DIAS provider, but how do DIAS providers work together and be able to ensure that people that are coming to their service and asking questions, how do they make it less complex for that person? And so there's going to be a conversation in the future.
And actually, I think as well that our single source of truth and communications is something that we are really focused on. But we don't know how to talk to everybody. We don't have a magic button that can reach everybody and give you all the information that you need. So we do kind of rely on people like yourselves to let us know how you want to hear from us. And you know,
Yeah.
I don't know if I'm articulating myself.
No, you are.
Which is ironic. I'm on the live stream.
Yeah.
People have asked us, or they've said, family carers are invisible on all levels. What work is being done to start supporting them?
Okay. So we really, really know that this is an important thing. It's a real important area. And we heard that again through community conversations, and I did mention it in my preamble. We're updating the carers strategy. And part of the update, there's some particular actions that as DSS within the Ministry of Health is to do. And there's actions that MSD is to do because it's a cross-agency strategy. And one of them is looking at respite options or carer support options like I Choose. The other strategy is looking at funded family care, systems transformation, all the things that we've mentioned in this live stream.
Somebody has asked us, will there be more metabolic specialists? Currently, we only have pediatric metabolic specialists and only 2 of them.
And as I said before, these are specialist medical services, and there are specialist medical services available. They are through DHBs, not through DSS. Again, though, we can ask that question and put something on the website, because I truly don't have an answer to that. But those are specialist medical services are available through the DHBs.
Somebody's asked us, will enhanced individualised funding be rolled out around the country while we wait for system transformation?
Well, somebody else said that's an excellent question, which we actually answered before. And I do acknowledge that there's some good things happening, and people feel like we've set up expectations. People feel that that's not easy to have to live with if you're not in that area. But we have heard loud and clear that this is what people want. And for those of you who don't know, enhanced individualised funding uses purchasing guidelines setting out how they can use their disability support funding in a more flexible way.
I think that's all the questions that we've got for now. Oh no, sorry, I can see. Sorry, one more. What about psychological support for carers?
Well, I don't have an answer, but as a family member and as somebody that talks to lots of families in the disability community, I know that you can go to your GP, and if you're stressed and needing support in terms of counselling, you can get free counselling through your GP, your local GP. It's available. So I know that that's available. I would need to find out about if there's anything that's through DSS.
I don't have the
But
answers.
I do know that you can access counselling support through your GP.
And I think my workmate is typing in the background that Carers Alliance have talked a lot with lots of carers, and they've got a list of priorities for carers such as respite. Somebody's asked, is there any provision for parents to be able to access ongoing training? And they say that we can send our support workers to courses and cover all the expenses, I beg your pardon, but zero provision for parents.
Yeah, I'm actually having that discussion with Health Workforce because that's a really good question. And often parents are the experts, right? You know, And we really acknowledge that. So how do we support development of your expertise? And we are actually talking about that now. If you have an idea about that, that would be great. Yeah.
Cool. I do think that's kind of all.
But we do have, sorry.
No, please.
We do have parent education training. I'm not quite sure whether, is that in every region? Yeah. It's called Incredible Years. And it's across the country.
Okay. All right. I do think that's all the questions that we've got at the moment.
Well, we're going to be thrown off this live stream any moment. Thank you. You've asked some really good questions. Apologies for not giving the answers because we couldn't give you the answers that you wanted. We had to be truthful with you in terms of what we can do. And but let's keep this conversation open. And when I say watch the space, I mean it. We are going to be looking at how we change things into the future. And our strategy is going to reflect that. And I talked about our focus areas. They are our focus areas. And I've just stood up a directorate for success, and that's your success. So thank you so much, and please provide us with feedback. Really, really appreciate you being here today. Thank you.
And also just a friendly reminder that there will be a transcript version of this live stream conversation. So that will be available in about 3 to 5 days. If you want, you can email us and we can send you a copy. Not a coffee.
That's what you need right now.
It is. Get in touch and we can email this to people. We'll also, any questions that haven't been answered right now, we will be sharing these on our website in more detail when we can. There are a lot of things that we can't answer, so please bear with us over the next wee while where we kind of work out where we're going and what we're doing. And let us know how you want to hear from us. Do you want more live streams? Do you want newsletters? What works for you? We need to hear that so we can keep talking.
Thank you.